Fertility Clinics for Brachycephalic Dogs by Riley, Nicole, Danielle, Olivia M., and Olivia K.
The use of a fertility clinic would be beneficial for multiple reasons. First, veterinary supervision would always be present to ensure no harm comes to any of the animals in use, mainly in the case that a cesarean section is performed. The clinic could also limit the amount of breeding that occurs among individual animals, and can also determine when the breeding of a line of dogs should be stopped due to genetic or physical abnormalities.
Brachycephalic dogs are known to have some pretty dramatic health issues. One of these health issues is brachycephalic obstructive airway syndrome. Brachycephalic airway syndrome refers to a particular set of upper airway abnormalities that affect brachycephalic dogs. The list of upper airway abnormalities that occur in this syndrome includes stenotic nares, extended nasopharyngeal turbinates, an elongated soft palate, laryngeal collapse, a hypoplastic trachea, and inverted laryngeal saccules. A dog can exhibit a combination of one or more of these abnormalities. Another common problem in brachycephalic breeds is dental issues. This is caused by the shortening of the muzzle. Dogs have a number of 42 teeth, and when the teeth are in correct order and position, they work well. When the jaw is short and wide, the teeth get crammed in there tightly. This results in teeth that are at the wrong angles, and the result is that food gets stuck between the teeth or shoved up into the gums, creating infection and gum disease, eventual tooth loss if allowed to continue. Another issue is unerupted teeth. The deciduous teeth become so cramped that they remain, resulting in permanent teeth that don't erupt. There are more permanent teeth than just the deciduous, so if the baby teeth can't fit in the dog's mouth, the adult teeth definitely won't. Another common problem in brachycephalic breeds is skin infections. This is due to their many skin folds and excessive wrinkles. The more wrinkled, the more bacteria and yeast growth. If not appropriately dealt with, these bacteria and fungus can grow into problems. These infections are painful and irritating for your dog. If you are an owner of a brachycephalic dog or considering owning one, make sure that you keep your dog's skin folds clean and free of excessive moisture.
Brachycephalic dogs have certain health issues. One of the health issues is their eyes. Brachycephalic ocular syndrome, where the eye sockets are too shallow. The eyeballs are prone to trauma, which can lead to enucleation, the removal of the eyeball, due to the inability to close the eyelids completely, the drying of the eye, insufficient lubrication, and ocular infections. This can also lead to ulcers. Brachycephalic dogs also have trouble with temperature homeostasis because they cannot pant and breathe efficiently enough to cool down. Another issue that brachycephalic dogs suffer from is due to their spine because of an abnormal unaligned vertebrae. It can lead to scoliosis or kyphosis. The spinal cord or nerves coming from the spinal cord also may be squashed or damaged. The image above is a pug with hemivertebrae, abnormally shaped bones in the spine. These dogs may also suffer from issues with their pelvis during birthing, where they have uterine inertia, lacking contractions. There may be fetal-pelvic distortion, leading to inevitable cesarean sections, and can lead to the death of the puppies and often the mother. The Cavalier King Charles Spaniel is a brachycephalic breed that is greatly affected by inbreeding. Nearly 70% of all Cavaliers have an inherited neurological condition called sphingomyelin, where their brain swells beyond the size of their skull. This condition can range from mild to asymptomatic, but in most cases, dogs will experience extreme pain and loss of coordination. With the help of fertility clinics, the disease can be detected with brain scans to help prevent further breeding. Another brachycephalic breed that suffers the consequences of inbreeding is the boxer. The lack of genetic diversity among their breed makes them highly likely to inherit juvenile kidney disease. This disease prevents their kidneys from filtering toxins. Their body will slowly poison itself until dying of renal failure. Fertility clinics should help isolate this condition and using blood tests and genetic tracking to avoid future breeding. Economically, fertility clinics would work because people want healthy pets, so they will buy from a reputable source versus a backyard breeder. Unfortunately, yes, the puppies will cost more, but because they are of a higher quality, it would make more sense financially in the long run.
Due to an increase in breeding regulations for these dogs, there will be an overall decrease in the availability of commercially bred puppies. And because of this, the cost of buying these puppies will increase. Also, because the puppies are of a higher breeding quality and have been handled by professionals, the likelihood of them needing extra medical care in regards to parasites and surgeries for facial deformities will be less.
Morally, brachycephalic dogs can be miserable and live a very harsh life, unable to breathe correctly and move around in an able body. Going through breeding fertility clinics will lower the suffering of what could have been another puppy with a disability characteristic. Breeding fertility clinics also regulate dog breeding and lowers the amount of puppies from commercial breeders. A dog birth overseen by a veterinarian is much more safer than one at home, especially when the cesarean sections are widely needed for births.
The number one problem with fertility clinics is that many are not run by veterinarians. They do not have a veterinarian on staff, thus they are doing cesareans and artificial insemination by untrained individuals. Some other potential issues could be that the dogs would be overpriced, that dogs could end up being abused, or that they could end up with improper owners. The real question is, would it stop commercial breeders from breeding? I personally think that it would not stop commercial breeders from breeding, unless of course there were strict laws and stark punishments for people breeding commercially without the proper letters of accreditation.
There are a lot of issues with fertility clinics. How to fix those issues are to have the clinic be managed by a veterinarian. All breeding must be done by artificial insemination directed by DVM. It must be AHA accredited with restrictions on the number of litters a dog can have. There will be legitimate background checks for clients, and the government will kickstart the business. Later on, the business will be able to fund itself with its revenue. And for the commercial breeders around in the area, official letters will go out to let them know that brachycephalic dogs are being regulated.
Ethical perspectives. Contractarian. If people approve of it, then so will I, so I am perceived as a good person. Utilitarian. I want to do what is right for our animals, so if it lowers suffering, I approve it. Relationist. I will do anything to care for animals, so if fertility clinics lessen pain, I approve it. Animal rights. Dogs should not be forced to be bred like they are in commercial breeding. Fertility clinics lessen the amount of times a dog is bred.
Olivia Knuth did the rough draft, research on health issues, edit, revision, the audios for slides, and audio combiner. Olivia Moore did the audio, images, formatting, and presentation and editing. Riley Davis did research on health issues and audio. Nicole Skinner did voiceover for slide 3, voiceover for slide 9, research on fertility clinic issues. And Danielle Taylor did the Cavalier and Boxer slides exam questions. Olivia Knuth did